My name is Deborah Liberto. I'm 69 years old. I am a fitness instructor and I had hip replacement 3 months ago. I had a lot of discomfort when I was seated or trying to lay down at night. There was a deep burning in those 2 areas. It ended up that I needed to have a hip replacement.
Typical same-day surgery is when a patient has surgery, takes about 1 hour, maybe a little bit less for the actual procedure. And usually the patients are home, discharged from the facility within 1 to 2 hours from the procedure.
After the surgery, within 6 hours, I was walking down the hallway at Morton Glen Hospital, back up the hallway. They had a platform that I had to cross the platform and then step off of the platform. And they said, "You're ready to go."
Care transformation is a priority at BayCare because we are constantly pushing the envelope to determine how we can better provide care to our patients. Our same-day discharge pathway for patients like Deborah came out of the work done within our Orthopedic Clinical Institute. We're constantly evaluating ways that we can provide care differently. And so for her, she was able to receive personalized care and was able to transition home and have a great outcome and good recovery without compromising any sort of clinical outcomes.
The healing process was going to begin immediately. I was going to rehab, do whatever they told me to do so that I could get back to teaching as soon as possible. I am so glad that I made the decision to have the hip replacement surgery. My experience with Dr. Harama and BayCare is just off the charts. I felt like I was royalty. They treated me so well. I totally recommend both the doctor and BayCare.